referrals have gone up significantly. We had a goal that we were trying to reach for, I think, about 2 years. And then when we went into HealthTalk A.I that year, we finally went past that threshold of the goal. My name is Carissa Cannon. I work with Kodiak Community Health Center in Kodiak, Alaska. We're on an island, so there are times where, we are that lifeline for them. There may be instances where we are only actually able to be accessed by either plane or ferry. The obstacles that we typically can face when it comes to any patient engagement or patient outreach can start with staffing, and as a FQHC there can also be budget obstacles as well. We kind of were missing like a very functional piece there. It's like you almost needed a little bit more hands-on help, but we didn't have the hands. Then we realized, the more we talked with Jared from HealthTalk A.I, that this was something that could be exactly what we needed when it came to being those extra hands without actually having hands, just the automated process, as well as the customizable option that HealthTalk A.I provides. With my position as data analyst, I like to kind of be able to dive more deeper into what we are, who we're reaching out to and how and why, and just being able to have more control in that area. Our most successful campaigns with HealthTalk A.I, we did start with a referral outreach program, and then not too long after we ended up going along with the cancer screening imports. The cancer screening has been very successful. We've been seeing our numbers go up when it comes to the referral closures, and as well as our measures going up for the cancer screenings. Referrals have gone up significantly. We had a goal that we were always trying to reach for, I think, about 2 years. And then when we went into HealthTalk A.I that year, we finally went past that threshold of the goal. And we are actually hoping to increase that goal and continue on and see if we can even clean up our workflow process, including HealthTalk A.I into that integration. The impact of HealthTalk A.I is pretty significant. I'm sure that they're appreciative that we are giving them those little messages, those reminders, to remind them to come in and see us and get that care that they need, that, before we might not have been able to do before based on like staffing. And when you think of automatic messaging, that there is no personal touches to it, but that is like the great thing about HealthTalk A.I is that I myself, as the champion, I'm able to update those type of messages that we send out to the patient. There's just so many ways that you can be impactful. It just doesn't feel, impersonal. It is personal. This is like an extension of myself or whoever else is on my team. Like they're just an extension of us. To anyone who is looking into working with HealthTalk A.I or even considering them, is to just do it, because I feel like for myself that the connection just with anyone on the team at HealthTalk A.I has held our hand through the process, answered any questions. There was just so many opportunities that we are given to make us feel comfortable with that integration. My advice is really just to go through the process, get to learn more, ask questions, and I just don't think anyone would regret it. The team that we've worked with, Jared and Kelly, and they've always been so helpful and so nice, and just been able to answer any questions, even if whatever time it may be in the day. And yeah, I think even though we've barely tapped the potential of HealthTalk. So I think I'm just excited to see what else we can do. Actually, I'm about to hop on a call with HealthTalk A.I to see what else they could do for us. So I'm excited to see what we can talk about.